Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. For today, our topic is the classification of agonist and antagonist. There are three types of agonist drugs. One is full agonist, one is partial agonist, and one is irreversible inverse agonist. First of all, full agonists are those drugs which in high concentration bind maximally to the receptors and produce maximum biological response are called agonist drugs. Partial agonists are those drugs whose binding is also 100% or at maximum level, but their biological response is less than those of full agonist comparatively. Inverse are those agonist drugs whose response is below the response before the drug introduction into the system are called inverse agonists. I will repeat, inverse agonists are those drugs whose response is less than the response present before the administration of the drug is called inverse agonist. Now we move on to the antagonist. Antagonists are those drugs which bind to the receptors and prevent agonist from their biological response. The biological response of antagonist is always absent in the absence of agonist. But when the agonist is introduced, they decrease the biological response of the agonist within the system. The antagonist have few type. One is competitive antagonist, the other is allocentric antagonist, the other is irreversible antagonist, and the fourth one is functional antagonist. We will discuss all of these stepwise. First of all, competitive antagonist. Competitive antagonists are those drugs which bind to the same site as the agonist drug and prevent and interfere with the biological activity of agonist drugs, thus decreasing its biological activity. These a competitive antagonist in actuality reduces the potency of the agonist drugs by interfering with the receptor and preventing the agonist from activating the receptor. Thus, the inactive state of the receptor is maintained by the competitive antagonist. Now we come to the second type, which is irreversible antagonist. Irreversible antagonists are those antagonists which bind to the same site as the agonist irreversibly, preventing the agonist from binding to the site. Thus, they decrease the number of receptor available for the agonist to bind on and produce a biological response. The irreversible antagonist in actuality reduces the efficacy of the agonist on the receptor site. Third number is allocentric antagonism. Allocentric antagonists are those drugs which bind to the other sides of the receptor or on other receptors but prevent the agonist from activating the receptor on which they are attached. So these type of antagonists are called allocentric antagonist. The last type of antagonist is functional antagonist. Functional antagonists are those antagonists which bind to the to other sites or other receptors, activating a function which is opposite to those activated by the agonist drugs. So they in actuality the biological response of the functional receptor is opposite. A functional antagonist is opposite to that of agonist. A very classical example of functional antagonist is the acetylcholine and epinephrine response. One is increasing the heart rate, the other decreases the heart rate, thus keeping the heart in a regular rhythmic momentum. This was all about the agonist and antagonist drugs. I hope we may have some benefit from it. Jazakallah khair.